Hi, I'm Dr. Vikram Raut. I'm Senior Consultant and Lead Liver Transplant Surgeon at Apollo Hospital, Navi Mumbai. Today we will be talking about the liver diseases and when you need to consider for the liver transplantation. The liver is important powerhouse of our body and it processes about 500 reaction at a time. So sometimes it's referred as the supercomputer of our body. The liver diseases are caused due to the various causes like hepatitis B or hepatitis C, which constitute about 50 to 60% of chronic liver diseases. Another important cause is alcohol. If somebody consumes alcohol over the limit on long durations, then it can cause a chronic liver disease. Other causes which is very important and nowadays increasing is non-alcoholic steatohepatitis or fatty liver. If a fatty liver persists for a longer duration, it can cause a liver cirrhosis and then you may need to consider for a liver transplantation. Another important causes for chronic liver diseases are autoimmune diseases or some immunological causes which can cause a chronic liver disease. Mostly the chronic liver disease are a long duration disease. So that means the liver compensate with the injury over a period of 5 to 10 years. But when it becomes obvious, it will start showing some symptoms. Not all liver diseases will need a liver transplantation. Initially, liver diseases can be treated with medicines. Like we have a specific medicines for hepatitis B or C. If it is diagnosed early and a treatment is started, the hepatitis B and C can be cured with the medicines and you don't have to consider a liver transplantation because you can stop this process at early stage. Liver transplantation needs to be considered when the liver diseases go to the end stage liver diseases. That means either medicines are not effective or there are certain complications are developed due to the medical treatment which cannot be controlled with the medicines. Usually we consider liver transplantation when the liver dysfunction in terms of bilirubin, INR and creatinine is significantly high, and we calculate something called as a MELD score based on patient's bilirubin, INR, creatinine. If the MELD score becomes more than 15, then you need to consider the liver transplantation. MELD score 15 indicates that there is a significant liver dysfunction and the risk to life is much higher than because of liver diseases. There are certain indications where the MELD score may be less, like if somebody accumulating the fluid in tummy or ascites repeatedly, or somebody developed the hepatic encephalopathy, or somebody developed the liver cancer. In that case, even if the MELD score is less than 15, you need to consider for a liver transplantation. So in summary, the liver diseases can be caused due to various causes like viruses, alcohol or autoimmune diseases. You need to diagnose liver disease at early stage and the preventive health checks are very important in diagnosis liver condition at early stage. If you diagnose liver condition at early stage, certain diseases can be cured with the medicines. When the liver dysfunction is significantly progressive and something called as end stage liver disease with MELD score more than 15, then you need to consider for the liver transplantation. And the liver transplantation offers definitive treatment for liver disease with a good long-term survival. Thank you very much.